As you can imagine, that interview getting a lot of reaction yesterday as well. So we're trying to get various views and voices on this to react forward. One of them is from the Progressive Health Forum, Professor Alex van den Heever, joining us this morning. Prof, good to have you on the show. Appreciate your time. Not sure if you saw the full interview yesterday, but I'm sure you would have just heard part of what Gayton McKenzie said to me yesterday. Your view on that, the life of a foreigner over the life of a South African. Where does the PHF stand on this?
Well, what I've just heard is rambling nonsense from a politician who doesn't really understand his role in government. The idea of politicians and the members of the executive and also sort of parliament are to create laws, not to break them. And what he was advocating there was the murder of foreigners in South Africa. That's basically it. And this also stems directly. He's really just following a line that started with the Limpopo MEC. And I think one has to sort of see that link. Operation Dudula and so on are all just kind of jumping on a bandwagon to pretend that they're trying to protect South Africans by attacking foreigners. This is a standard distraction technique for electoral politics by politicians usually that don't really have a clear policy agenda. You don't really hear any substantive policy from them, but they're very, very brave in attacking people who are vulnerable and weak and can't fight back. And that's really what I hear in all of this. And it's essentially, on the one hand, hate speech, but if somebody starts in the health system who's influenced by the comments of people within government and with official standing who are influenced by it and then actually do what they say, then they are also culpable. These politicians are culpable for the actions of officials who actually follow on from this. And it's worth noting that in Portugal yesterday, the Minister of Health resigned because a foreigner died in their hospitals. That's the kind of thing that you expect from a decent government, is that if something happens, that was a foreigner that died, and that was enough for a Minister of Health there to resign. In this country, they're actually saying, we're going to kill foreigners.
Is there a point to what Gayton McKenzie is saying, and there are some others who also support that particular viewpoint, that overseas, even as a foreigner, you will receive the care that is needed? The issue seems to be the underlying problem, Prof, that here in South Africa, we don't have the structures in place that we should have from a public health care system. We don't have enough staff. We don't have enough infrastructure. Is that really the underlying issue here, that if we didn't have these issues in our public hospitals, we wouldn't even be having this discussion?
No, I don't think so. I think that this kind of political diatribe is a form of distraction from the fact that the politicians responsible for these comments aren't actually substantively contributing to policy development. So what we do need is to deal with our fundamental problems, but you can't deal with them by breaking the law, which is what all of these people, all of this rabble is actually proposing. They're not proposing to make laws, to build systems. But what we have is a crumbling system in the public healthcare environment because of institutionalized corruption that we've experienced. Now, all of the people that are talking about this thing say nothing about that. That's of no interest to them. So the issue is we are not dealing with resource constraints because of foreigners and Zimbabweans. They aren't the ones that have basically institutionalized corruption in South Africa. So I think it's very important that we don't get distracted by a debate that is not real. And to the extent that we need to manage people moving across borders, that is a responsibility of government to create legal frameworks, treaties, international arrangements, and sort that out properly. What you don't do is break the law because you haven't made the laws.
Let me ask you this as well, still very much on the same tact of foreign nationals and illegal foreign nationals, Prof, as well. We've seen outside the hospitals, this is out in Kalafong, Operation Dudula, reportedly vetting what looks to be patients trying to enter the hospital. They're vetting them on what I'm seeing here in these reports, appearance and skin tone, and demanding to see identification. What's the view then of PHF on that? It's access to healthcare, isn't it? This is the problem. What do you make of this?
Well, part of this is part of a political campaign and political distraction again. Now, if we had to look at that dastardly intervention. They're applying the equivalent of the pencil test under apartheid. And we know that that was part of the apartheid government's political distraction campaign, the Swart Gevaar. So now our Swart Gevaar are Zimbabweans. This is basic. They're breaking the law. They're interfering with patients. They're touching people. They're threatening people. They have no role in getting near to anyone or interfering with anybody's access to a healthcare facility. And what concerns me is the fact that the police are doing nothing to protect those patients gaining access to the hospital. And it's important to note that the interview with the CEO of the California Hospital was saying they're not even dealing with a problem of excess. Most of their patients are South Africans. But he also said something very important. He said, we don't have data. We don't have information. So on what information are people basing their supposed crisis of migrants flooding public hospitals? There is no information, no costing information, no indication of resource implications. It's a fabricated crisis in order to target vulnerable people who can't fight back as part of a political machination.
Prof, I appreciate your time in weighing in on this for us this morning. Professor Alex van den Heever from the Progressive Health Forum. Of course, this conversation continuing online as well on social media. I'd love to get your thoughts on the response from the Prof and also Gayton McKenzie.